Hi all, I am Dr. Rini fertility consultant and an IVF specialist. So in this video we are going to discuss about when you have to approach a fertility clinic or a fertility specialist and what test you have to do before going into other treatment options. So when do you come to a fertility specialist? You are married for 1 year and you have tried conceiving naturally consecutively for all the months and you are not able to conceive. So that is the time when you come to the fertility specialist. If in case the female partner is more than 35 years old, then if you are married within 6 months, if you are not conceiving, definitely you have to come little earlier. You need not wait for 1 year to conceive, because after 35 years the fertility profile and the fertility conception is going to become less. So what are the tests which you have to do? When you come for a fertility test, the couple, both the male as well as the female, have to come for the test, because childbearing is depend upon both the male partner as well as the female partner. So for the male partners, what we are going to do, the basic test is the blood count has to be done, sugars has to be tested, and a basic semen analysis has to be done. So what do you see in a semen analysis is, we are going to see the sperm count, the motility of the sperms as well as the morphology. If in case the first report of your semen analysis is found to be abnormal, so don't get panic. We have to definitely recheck it for the second time, might be after 2 to 4 weeks, and then reconfirm the first test. In case of a female partner, what has to be done is certain blood test and some scans has to be done. So what blood tests are important? First is the sugar test, because India is the capital of diabetes. Definitely the females has to be checked for sugars, the fasting sugar as well as the postprandial sugar. Apart from that, certain hormonal panel which includes thyroid stimulating hormone, that is the thyroid test, serum prolactin, and a very important test is the AMH, which is the anti-Mullerian hormone. It is a fertility marker. It says how much is your egg count as well as your quality of the eggs. So these tests has to be done first, followed by which you need to undergo a ultrasound scan. This scan is preferably done on 2nd to 3rd day of your periods, which gives a better visualization of your uterus as well as your ovaries. So in the scan we are going to look for your uterus. If there is any fibroid, adenomyosis or any endometrial polyp, we are going to screen it in the scan. As well as we will look to your ovaries, and in the ovaries we are going to count how much is your antral follicle count, that is the number of eggs present in both the ovaries, and also to look for any other cyst like polycystic ovaries, a simple cyst or an endometriotic cyst, which we call it as a chocolate cyst. These screening has to be done on your 2nd to 3rd day. Apart from the scan, we need to do a HSG test, which is a tubal test, to find whether your tubes are patent or blocked. This test is usually done between day 7 to day 9 of your periods, which is the better time to do the HSG test. So depending upon the test for both the male and the female partners, we will take a call whether you need to proceed with further fertility treatments or whether you can continue trying naturally for few months before going into the treatment. Thank you.